Good afternoon, everybody. Hi again. So I'm going to do hopefully some justice to a program that we've been implementing here in the U.S.-Mexico border region, but it has broader implications and something that we've been talking about with a lot of our colleagues in maternal and child health, in particular through the core group, which is a network of member organizations doing that kind of work around the world. And basically, you know, it really builds upon what was talked about in the last session before lunch in Afghanistan, the PTSD issue. You know, violence and the fear of violence and stress and strain and inequities and life causes maternal mental stress. And that's different or additive to what we're used to calling, you know, postpartum depression or something like that. And that we have found in our work that this is not something that's very well understood or studied, that there are very few resources, particularly in the parts of the world where we work, very few you know, services that are capable of addressing these issues, and a lot of stigma around these topics. Even if the stress is not as great as it is in a war-torn area or something like that, this issue of fatalistic thinking, of thinking about, you know, of hopelessness and stress and strain and fear, whether it's a fear of immigration here in the San Diego area or it's a fear of you know, some other kind of violence or shock. It really is a real issue. And it has implications not just for maternal health and well-being, but obviously for reproductive health and well-being and for the health and well-being of children and family. So there are tools that are out there, different services are out there, but we need to be creative about what we can do in resource-poor settings. Obviously, just identifying women at risk and understanding the factors that are at play are very important. Whether you're doing a very rigorous screening using, you know, psychological screening tools, or whether you're just including that into your basic health or nutrition screening. Either way, it's very important to do. And the idea of, you know, testing and trying out new approaches with multicultural, multilingual, you know, populations are important, obviously. And then even without highly skilled support, again, in these resource-poor settings, there are things that we can do. And this particular methodology is really, it's a facilitation process. It's a group discussion. It's a support mechanism and a platform for screening and referral. And so we've, as I mentioned, used it here in the San Diego area, bringing Latino women together to talk about issues that are of concern to them, and basically leading through a you know, facilitated series of sessions. You know, we don't need to go into the details here, but basically it's a self-esteem, self-reflection, social cohesion, social support process, talking about issues of gender, talking about issues of violence, whatever is of concern for the women, and getting them to think broadly about their own health and well-being and how that affects the family, and you know, bringing into the light some issues that tend to be stigmatized and kept under wraps. So in our case, you know, using these sessions and then applying screening methodologies and tools to measure depression scores, we actually saw a very surprisingly high increase or improvement in depression scores, both in Latino women in general and in pregnant women that were in our program, a Healthy Start program funded by HRSA. So that's pretty much it. I just wanted to mention that as we've been sharing this more broadly with organizations, you know, Save the Children, CRS, World Vision, that do work in, you know, many countries in maternal and child health, it's been such an eye-opener for them to think, oh yeah, duh, we should be thinking about maternal mental stress. We need to be thinking about this as well as thinking about other health and nutrition and well-being issues. So it's been absolutely unbelievable to me how much openness there is to taking this on, and how much realization this has been a very undercovered area. So thank you.